Dr. Nili. I'm a psychiatrist, board certified in adult psychiatry and child and adolescent psychiatry, and I work at PMHC in Center City, Philadelphia. I also have done extra training in integrative and holistic medicine. Today I want to talk about the role of psychiatrists, especially in the area of medication and medication management. So before I start talking, I want to bring up two important issues. First important issue I want to bring up is about DSM, which is the diagnostic manual that psychiatrists use to diagnose psychiatric illnesses. So the DSM is based on statistics. It's not based on biology. And Dr. Thomas Insel, the director of National Institute of Mental Health, in 2012 had a very interesting blog about the DSM, where it was explaining that unfortunately it's not based on biology, it's based on statistics, so we cannot exactly know what is the underpinning of an illness. And the new way of doing diagnosis and doing research is to find the biology of a neuropsychiatric illness. I'm going to be calling what we call mental illness neuropsychiatric illness, because I think that's a better way to define them. So the idea here is that when we talk, let's say, depression can be because of many different reasons, and the biology of depression can be very different for different people. So one very promising way of research has been inflammatory reason of depression, because we have actually markers of inflammation, and so we can know if somebody who's depressed also has high level of inflammation, and can try to find medication that would work for that person. The person who's pioneering that type of research is Dr. David Michelon, who's a Harvard professor, and he is working on the biology of depression with inflammation. He's also working on what he calls natural medication, which is my area of interest, which is what we call, all of us, the natural supplement. So he does research, he has done research and studies, and I'm going to talk about one of them, which is SAMe, S-anilmethionine. That is a natural molecule that we have in our body, and we can also get it as a natural supplement that has been helpful in depression. And Dr. Michelon has done studies, mostly adding them to some other antidepressant to show that they are effective. And another natural supplement that has been effective is St. John's wort, which in other countries, let's say Israel, is actually a prescription medication under the name of Remotiv. So they are outside the regular medication. We also have natural medication, and again, they can also have side effects, but their side effect profile is different. The other issue that I wanted to bring up was the placebo effect. When they do study on a medicine, they always also use a sugar pill. So they have their medication in one hand that they give to a group of patients, and a sugar pill that they give to a group of patients. And when they look at it at the end of any study, they look at the placebo effect. There is always a percentage of patients, it could be between 40 to 60%, that will respond to the sugar pill as well as to the medication. So my area of interest has always been, what is that placebo effect? How can a sugar pill work so well? And I've been actually researching that, and it looks like it's about hopefulness. It's about a person is hopeful that finally they're gonna get better. Somehow they actually do get better. And there is a lot of reason, I'm not going to go through that and explain it. There's a lot of reason that hope can be so powerful. So one of the things that I try to do when I see a patient for medication, I'm trying to kind of incorporate everything in my approach with the patient. The first thing a psychiatrist will do, any psychiatrist, is when we talk to a patient, we try to make sure that there is no safety issue. we try to make the person comfortable so they can tell me if they have any thoughts of wanting to harm themselves or harming someone else. Because there are things that we can do for that. The other thing is if they are feeling that they're losing touch with reality, I'm going to need to know that, because again, we have medication that can be very helpful. The other thing is I try to be holistic. I try to look at the whole person. I try to look at what are they eating. I was talking about inflammation. What we eat can have a big impact on the inflammation. And so an anti-inflammatory diet, mostly based on fruits and vegetables, can be very helpful with the treatment of any neuropsychiatric illness and also physical health. Then there's exercise. There's a lot of studies on how powerful exercise is in the treatment of depression, especially. And I try to look at are they getting enough light? So we know about light therapy in depression, and also there are studies on the effect of nature, trying to get people to get out of their house and be more with nature. Then we look at their sleep, which is really important again in neuropsychiatric illnesses and in any health issues. Getting people to get back to sleep in a more natural way by trying to work with them in what we call it sleep hygiene, and also there are some medication that can be helpful. Now let me give you an idea of how that would be when you are in my office and we're trying to talk about the medication. The first thing I can understand is how you feel about taking a medicine that can have effect in your mood and in your behavior, and how worried you are about that and doing that. So we try to create together a time at night maybe where you will be taking this medicine, but part of a ceremony of healing. You will take the medicine, you will take a deep breath, you will take that medicine and you will tell yourself, I am taking care of myself. I'm exercising, I'm eating better, and I'm taking my medicine like I'm taking all my vitamins to get better, and I'm hopeful. So that is how I kind of try to look at the whole thing and have a picture and give you an idea of what that interaction can be. Thank you for listening.